If you're a man over 50 and you've noticed that your performance in the bedroom isn't what it used to be, I need you to listen very carefully. That frustrating lack of an erection, that moment of doubt when you need it most, is not just a private disappointment. It's a critical warning siren from your body. What most men dismiss as just getting older is often the first visible sign of a silent enemy lurking deep within your veins. An enemy that is directly threatening your heart. The truth is, your ability to get an erection is one of the most powerful built-in indicators of your overall health, and ignoring its message could be the biggest mistake you ever make. The link between your performance downstairs and the health of your heart is so direct, it will shock you. I'm Dr. Claire Foster, a urologist specializing in men's health for over 15 years. In my practice, I've helped thousands of men reclaim their vitality. And I've done it by looking at the one thing conventional medicine often ignores: the body as a whole system. That erection isn't just a mechanical function. It's a direct reflection of your cardiovascular health. And today, I'm going to pull back the curtain and show you exactly what that signal is trying to tell you, and more importantly, what you must do about it, starting tonight. Ignoring this problem is a dangerous game. Many men I see try to brush it off. They think it's just their age, a loss of mojo, something to be endured in silence. But what they don't know is that with every failed erection, their body is screaming about a deeper issue. This isn't just about sex. It's about the risk of a future where you lack the energy to play with your grandkids, the vitality to travel with your partner, or even the basic health to live a long, independent life. It's the silent creep of clogged arteries, the quiet strain on your heart, and the slow erosion of the confidence that makes you who you are. The belief that this is a normal part of aging is a lie. It's a symptom, a powerful one, and once you understand what it reveals, you can take back control. As we get ready for the big reveal, tell me in the comments which city you're watching from. I love to see how far our health community reaches. So, let's decode what your body is truly telling you. We're going to look at the 3 critical health warnings that a lack of erection reveals, and the first one is the most direct of all. It's the canary in the coal mine for your heart. The first hidden message is **** silent cardiovascular disease ***. Before a man ever feels a single chest pain or gets a scary diagnosis from a cardiologist, his erections often start to fail. This is where the danger lies. The symptom appears in the bedroom, but the cause is in your blood vessels. I remember a patient, Robert, a 67-year-old retired engineer. He came to my office, clearly embarrassed. "Dr. Foster," he said, "I feel fine, my energy is good, but things just ... stopped working. My wife is understanding, but I feel like less of a man." He was convinced it was just a local issue, maybe low testosterone. He was skeptical when I told him we needed to look at his heart first. After a full cardiovascular workup, the results were stunning. Robert had significant blockage in his smaller arteries, the early stages of atherosclerosis. It wasn't life-threatening yet, but it was a guaranteed path to a heart attack in the next few years. We immediately put him on a protocol. 6 months later, Robert came back to my office, a new man. "You didn't just save my marriage, Doc," he said with a grin. "You saved my life. And everything is working better than it has in a decade." Here's the simplified science. Think of your circulatory system as a massive network of highways and small country roads. An erection requires a surge of blood flow into the penis, which happens through very small, delicate arteries. These small arteries are like the country roads. When plaque and inflammation start to build up, what we call atherosclerosis, these tiny roads are the first to get clogged. The major highways leading to your heart might still seem clear, so you don't feel any chest pain. But the blockage in those smaller penile arteries is the earliest, most obvious sign that your entire system is in trouble. It's basically a preview of what will eventually happen to the larger, more critical arteries around your heart if left unchecked. The science is clear on this, so here is your practical application protocol. Starting today, I want you to incorporate one simple habit: the cardio flow walk. This isn't a stroll in the park. It's 30 minutes of brisk walking, fast enough that you can still talk, but you're slightly out of breath. This powerful habit forces your blood vessels to dilate, improves circulation, and fights the inflammation that causes plaque buildup. Do this every single day. It's not just a walk, it's a direct intervention for your vascular health. And if you found that revealing, wait until you hear about our second item, as it affects the body in an even quieter, more hormonal way. The second secret your erection is revealing is undiagnosed type 2 diabetes ***. Millions of men in the United States are walking around with prediabetes or full-blown diabetes and have no idea. They blame their fatigue and weight gain on age. But the damage is already being done, and one of the first places it shows up is in the bedroom. Let me tell you about Charles, a 62-year-old high school football coach. He was a tough guy, used to being in control. He came to see me, frustrated and angry. "It makes no sense, Doc. I'm strong, I'm active, but when the moment comes, it's like a power outage." He was eating what he thought was a healthy diet, but it was full of hidden sugars, fruit juices, healthy cereals, and sports drinks. He was completely unaware that his blood sugar was on a constant, damaging roller coaster. When we tested his A1C, a measure of long-term blood sugar, it was dangerously high. He was pre-diabetic and on the fast track to full-blown diabetes. The diagnosis was a wake-up call. We completely overhauled his diet, focusing on protein, healthy fats, and fiber. 3 months later, his blood sugar was back in the normal range. "It's incredible," he told me. "I have more energy on the field. I've lost 15 pounds without trying. And let's just say my wife is very happy the power is back on." Here's the simple science behind it. Think of your nerves and blood vessels as the electrical wiring and plumbing of a house. High blood sugar is like pouring sticky syrup all over that delicate system. Over time, this sugar damages both the small nerves that transmit arousal signals from the brain to the penis, and the lining of the blood vessels, making them stiff and unable to expand properly to allow blood flow. This double whammy of nerve damage neuropathy and blood vessel damage vasculopathy is why erectile dysfunction is one of the most common complications of diabetes. What most people don't know is that this damage starts happening years before a formal diagnosis. What worries you most today? Type 1 in the comments if it's your heart health, or 2 if it's your energy levels and blood sugar. Your answer helps me create future content. Here's your practical application protocol. I want you to perform a pantry purge. Go into your kitchen right now and eliminate the 3 biggest hidden sugar bombs. Sodas including diet soda, fruit juices, and any breakfast cereal that lists sugar in the top 3 ingredients. Replace them with water, herbal tea, and a breakfast of eggs or Greek yogurt. This one move alone can dramatically stabilize your blood sugar and begin to reverse the damage. Never underestimate the power of removing these silent poisons. Now, if you thought sugar was the only dietary villain, you're in for a surprise. The third warning sign is even more insidious because it's linked to foods many people believe are healthy. The third thing your erection is telling you about is chronic systemic inflammation, This is a hidden fire raging inside your body. It's not the acute inflammation you see with the cut, but a low-grade, constant irritation that damages your cells and tissues over time. And it is a primary driver of almost every age-related disease, including heart disease, diabetes, and, you guessed it, erectile dysfunction. I had a patient named David, a 71-year-old retired lawyer. He was doing everything right. He ate whole wheat bread, used vegetable oils for cooking, and had a salad every day. Yet, he suffered from joint pain, brain fog, and a complete inability to get an erection. He was frustrated, saying, "I follow all the health advice, but I feel like my body is falling apart." The truth was, his healthy diet was fueling a massive inflammatory fire. The vegetable oils like soy, corn, and canola, the processed wheat. And even some of the dressings on his salads were highly inflammatory. We switched him to an anti-inflammatory protocol, focusing on healthy fats like olive oil, avocado, and fatty fish, and removed the industrial seed oils and processed grains. The transformation was astounding. Within 2 months, his joint pain vanished, his mind felt sharp again, and he called me, almost laughing, to say, "Doctor, Farster, I feel like I'm 40 again. The plumbing works. And my wife can't believe it. Here's why this happens. Imagine the delicate lining of your blood vessels, called the endothelium, is like a smooth, non-stick Teflon pan. It allows blood to flow freely. Chronic inflammation is like taking sandpaper to that pan every single day. It scratches and damages that smooth lining. Your body's response is to patch up the damage with cholesterol, which eventually leads to the plaque that clogs arteries. So, inflammation is the spark that lights the fire of atherosclerosis. Recent studies from leading universities confirm that controlling inflammation is paramount for vascular health. This constant, low-grade fire makes it impossible for the blood vessels in the penis to relax and dilate properly, effectively shutting down the entire erectile process. Your practical application protocol is simple but powerful. I want you to make one crucial swap: the oil exchange. Throw out every bottle of vegetable oil, canola oil, corn oil, and soybean oil in your kitchen. These are packed with inflammatory omega-6 fatty acids. Replace them with extra virgin olive oil for dressings and low-heat cooking, and avocado oil or coconut oil for high-heat cooking. This is one of the most powerful, guaranteed ways to reduce the silent fire of inflammation in your body. It is a non-negotiable step toward reclaiming your health. Alright, let's consolidate this powerful information into a clear action plan. We've pulled back the curtain, and now you know that a lack of erection is never just a bedroom issue. It is a critical health barometer. So to recap, the 3 silent villains your body is warning you about are: Number 1, silent cardiovascular disease, the canary in the coal mine for a future heart attack. Number 2, undiagnosed type 2 diabetes, the sticky syrup that damages your nerves and blood vessels. And number 3, chronic systemic inflammation, the hidden fire that damages your arteries from the inside out. The truth is, your body is communicating with you. By taking these 3 warnings seriously, you can not only restore your sexual function, but fundamentally change the trajectory of your health for decades to come. Change is possible, and it starts with these simple, consistent actions. Your body hasn't forgotten how to be healthy. It hasn't forgotten how to be strong, vital, and full of energy. It just needs your command. It needs you to listen to its signals and give it the right tools to heal. You have the power to rebuild your health from the inside out, to reclaim that confidence, and to not just live longer, but to live better, with the strength and vigor you deserve. This isn't the end of the road. It's a new beginning. If this information was valuable to you, please hit the like button so YouTube will show it to more men who need it. And don't forget to leave a comment. I personally read as many as I can. Share this video with a friend or family member who, will benefit. And of course, subscribe to the channel so you don't miss any of our future health guides. And one last thing, a personal request. I recorded this video wearing a mask. It was really important for me to know if the sound quality was good and if you could understand me perfectly. Please leave a quick comment about it. Your feedback is crucial for me to keep improving. A big hug, and I'll see you in the next video.